Welcome to the Biohacking Beauty Podcast. My guest today is the amazing Dr. Amy B. Killen, a personal hero of Young Goose and many other people. And it's a real privilege to have Amy on our podcast. And I'm asking you, Amy, to please tell us a little bit about yourself, what you're doing, a little bit of your background, and we'll go from there.
Awesome. Well, thank you so much for having me. I'm a big fan of you guys as well, as you know. I am a physician. I'm a medical doctor. I specialize currently in kind of integrative and anti-aging strategies using all kinds of all the techniques, including regenerative medicine, including stem cells and things like that. I have a kind of a special focus on skin health and sexual health. Those things have kind of come out over the years, and just having patients ask me over and over again, can you please help me with my skin? Can you please help me with my hair and with my sex life? So I kind of think of those things as like sort of like next level health things, right? Like once you kind of get out of survival phase, like once you're able to like start thinking about other things besides just like making it through the day, then people start thinking, oh my gosh, well, how can I get my skin healthier? How can I get my sex life better? And so it's a weird combination of things, but that is what I do now. And I love it.
That's awesome. And how long have you been doing it? When did you start and how did your journey lead you?
So I was an emergency physician for the first 10 years of my career. So I went to emergency medicine residency, and I got board certified in that. And then I worked in a really busy ER in Texas, in Austin, for about 7 or 8 years. And then toward the end of that, I had my 3 kids within a 2-year period, and I had a lot of stuff going on, and basically decided that I was not taking good care of myself or my family, and ultimately my patients. And so I kind of started thinking about like, what else can I do? So I learned a whole bunch of new things, went to new fellowship programs, did new training, and then over the course of a couple of years, pivoted into doing more integrative medicine, more preventative medicine to try to make myself healthier and also my patients.
And then slowly just kind of found what is interesting you and interesting specifically for your patients, that you can help them with their specific needs. Well, I guess obviously, since you have such a striking appearance and the fact that your skin is really impressive, that's probably what led them to ask you, in general, what they should do, right? Was that kind of the process? They wanted to get the same results that you're getting?
Well, thank you. I don't know if that's the reason. Well, so I was doing a lot of hormones. I was doing a lot of bioidentical hormones for men and women. And what would happen is I would see these people who would come in and they were just struggling. Like, they were depressed. They were having lack of motivation, lack of energy. They were gaining weight. Like they were having all of these hormonal changes and were having a lot of problems. And so I would kind of help them through that using diet and lifestyle as well as hormones themselves. And then a few months later, they would come back and they'd be like, okay, like I'm finally starting to feel better. I have the energy. I have the motivation. Now I want to look better. Now I want to have more confidence. Now I want to have more connection with my partner. And so I really think it just kind of evolved from seeing patients kind of at their worst. And then as they got better, they realized that they could even go better and better and better if they kept working at it.
So just to pick your brain a little bit about what's going through your mind when that shift happens, right? So someone's taking care of more their pressing needs as far as things that they need to fix in order for their life to go into like an abundance mentality, if you would, and then they have the conversation with you, right? I want the next level. How do you approach it? Like, what do you start with first? What's interesting for you to learn about them to progress it? How do you approach it?
I think that dialing in the foundational stuff is always the most important first step. Like there's, none of the fancy stuff, none of the tricks and the stem cells and all of that is going to do much good if you haven't laid a foundation of health. So I think it's always best to start with, what are you eating? How much are you sleeping? How are you dealing with your stress and stress life? Because stress is awful for skin and sex and hair and everything. Are you exercising? How much are you lifting? Are you moving? All the kind of things that like we all know are good for us. Those are the things to start with because that's important for skin health, for hair health, for sexual health, just for health. And then once they've kind of gotten through some of that stuff, maybe we'll add in some of the cool like biohackery stuff. Maybe we'll add in, I don't know, red light therapy or cold plunges or saunas or things like that are maybe like a little bit sort of higher level things that not everyone knows about. And then after that, maybe we'll start adding in other kind of medical strategies if they need them, things like injections or lasers or other, techniques like that.
Understood. So jumping straight to the more fancy stuff, because I feel like we have an opportunity here to really talk to you about the more cutting edge part of beauty, whether it would be like skin health, sexual health. I feel like you're really on the bleeding edge of what's going on now in medicine. So I would love to just jump to that. What are you seeing are like the best modalities for you to give people results? Whether it's, obviously these are two things that feed off each other and complement each other, but I mean, like as far as protocols, they might be a little bit different.
Right.
But what do you see are like the best things, the real heavy hitters of your practice and your approach?
So I personally do a lot of work with stem cells from the patient, as well as exosomes, which come from like placental stem cells, and PRP, which is from the patient's own blood. So I use a lot of these growth factors in both for skin health, for hair health, and for sexual health, where we're essentially injecting those things. Like for the skin, I'll inject those into the skin of the face. I'll also do microneedling and then apply those things topically. And those growth factor kind of strategies, regenerative strategies, are really great for helping your own body to start to repair itself and to heal itself. So you're kind of telling your own body with these growth factors, hey, we need more collagen, we need more elastin, we need more hyaluronic acid. Our skin is getting older. And so these are great for kind of upkeep of skin and making the skin actually healthier. And then then I'll add in other things like, I have access to several different types of lasers. And that kind of depends on what the problem is. Is the problem dark spots from the sun? Is the problem that you want tightening? Is the problem that you have discolorations from other things? So it kind of, that is really more tailored to what the person's particular problem is as to what works best. I find that the PRP and the exosomes and stem cells, that works for everyone, because everyone, all it's going to do is kind of help your skin to become more fresh and more youthful. And then the lasers and things like that, radiofrequency treatments, radiofrequency microneedling, all of that is also great, but it really depends on what the underlying problem is and what the goals are.
You're reminding me a little bit what we're trying to do when we're explaining the Young Goose system, which, like, I would say 90% of the people need to kind of contact us or reach out and say, guys, could you please like explain to me exactly what I'm doing with these products that I have? Because what we're trying to do, and it's kind of similar, I feel like, to what you're doing, is first of all, we are trying to get the cells to function on a more youthful state. Functioning optimally, getting them to perform to their best. Yeah. And then normally, because we still need to give the skin a little bit of direction. We still need to give it some homework. We basically need to ask it to do something specific if there is an acute problem that we want to treat, right? And then you're going into a specific set of modalities, or one modality that would require something specific of the skin. And then the skin can perform it better because you've dialed it to its utmost potential beforehand. Does that, is that similar?
Yeah, no, I love that analogy. I think that's perfect. I think that something like, PRP or stem cells or exosomes, again, applicable to almost everyone, because you're just kind of ramping up how well the skin is functioning. And then I have patients that will afterwards, they'll go and get laser treatments, or they'll get filler to help with volume, or they'll get facelifts. But those are all different things. And so I think it's important to note that there's not one thing, whether that's in skincare or in just the things like I do, that works for everyone, for every condition, all the time. Like, we're all very different. And so people are always asking me, like, what's the one thing that I should do for my skin? And I'm always like, well, sunblock, and like, maybe, like, I give kind of a generic answer, because it's hard to say that there's not really one thing. There's all these different things that we can use in combination.
Yeah. And so maybe you could just to make sure that we're covering the base well, how would you explain stem cells to begin with? How do you explain that trio? Because they're kind of, different aspects of the same family, right? PRP, exosomes, and stem cells. You could start with whatever. Just, I think people have heard about stem cells so much lately in the last few years. So everyone know that they kind of have them, but why would someone use them? Like, how do we use them? How do we get them? What do they do?
Totally. So stem cells are the cells in your body that are responsible for the upkeep of all the different tissues and organs in your body. So they can replicate, they can make more of themselves, which not all cells can do. And they can also differentiate, which means they can turn into different types of cells. They can become skin cells or muscle cells or bone cells. So they can kind of differentiate. So what happens as we get older, the stem cells in our body, they become less able to communicate with each other. They have fewer growth factors. They have sort of less able to replicate and do their job. And so what we're trying to do with all of these regenerative strategies, whether that's PRP or stem cells or exosomes, is communicate with the stem cells that are already there in our bodies that they need to become more active again. So that's what we're trying to do in general. So there's a couple of different ways we can do that, and depends on where you live and kind of what the rules are. Platelet-rich plasma is available everywhere, like anywhere in the world. You can use your own blood, and basically we take blood from the patient and then we centrifuge it, we spin it, and then we just isolate the platelets and we concentrate the platelets, because the platelets have a lot of these messenger proteins and cytokines and growth factors in there that when you inject them into the skin or into a joint or wherever, they will get released, and then they communicate with the cells you already have in that area. And they tell those cells, hey, we need you guys to be more active. We need some more blood vessels. We need more collagen, whatever it is. So that's PRP, and that's been around for decades. It's super safe, and there's really very little controversy about it. And then the next other kind of step up from that is using stem cells from the patient, like bone marrow stem cells, or in some places fat-derived stem cells, where we do a small procedure, we get their own stem cells and we concentrate them, and then we can inject those just like with the PRP, but they are actual cells. So they're a little bit more active in the way they communicate with the cells that are already there. And then similarly, exosomes, which are kind of a group of these growth factors that come from stem cells. They're like the action arm of the stem cell. And these exosomes or secretomes, they're also called, they can come from all different types of stem cells. Most commonly, they'll come from like placenta, like full-term babies delivered to placenta gets donated instead of thrown in the trash. And then those cells get used. And those are really youthful growth factors. And so they can communicate and sort of act as stronger messengers sometimes than the ones the person already has. So all of it sounds super fancy, but the underlying thing we're trying to do is just send signals to your cells that are already there to get your cells to be more active and to really do their job like they were younger acting cells.
And awesome. That's an awesome explanation. Two questions that I've kind of stumbled upon before people are asking. The first thing is, as far as exosomes go, are there different kinds? So, there are companies, there is a Korean company that has a product for eczema with exosomes. There are a few companies that make it and, are kind of skirting the lines of saying that it can replace stem cells. The FDA doesn't really let them. So
right.
They're trying to hint on it, but staying in the skin realm. So are exosomes just like a general saying, like you would say stem cells, or do different ones have different roles?
Yeah, that's a great question. Yeah, there are all different types of exosomes. And honestly, we're just beginning to see different companies coming out with really different types. So exosomes typically in the past have come from either bone marrow derived stem cells from like a young person, like a 20-year-old donates bone marrow. And then that bone marrow gets cultured, and then they essentially stress it. And then the cells release these exosomes, these growth factors, and then they scoop up just the exosomes and we'll use those. So that's what some products are. They're bone marrow derived. A lot of products are from birth tissue products, not embryonic. No babies are getting killed in the process. This is birth tissue that would have been thrown in the trash that's instead taken to a lab. So that's like umbilical cords, that's amniotic fluid, that's placental tissue. And so a lot of the exosomes come from those sources. But you can get exosomes really from any cells in the body that release them. Like all different cells will do this. And what's coming and what we're going to see soon, if it's not here yet, is these exosomes that are made specifically to do a specific job. Because the exosomes are just growth factors. They're just signals. And right now we're just kind of saying, okay, well, these signals will probably work, in different parts of the body, but ultimately we'll have exosomes that are specifically for skin repair or specifically for eczema or for, increasing blood vessels or whatever. And those are not most of those are not here yet. The rules with the government, at least in the US, is that we aren't allowed to inject the exosomes. We're only allowed to apply them topically right now. So we can use them for skin and hair, but we're not supposed to be injecting them into the bloodstream unless we have special sort of grants to do that. But I think that there's a lot of potential with exosomes.
Okay, and that's like I love the sentence that you said in the end, because if someone is following you and your Instagram account, and which is more than highly recommended. I don't know how are you even functioning if you're not following Amy Killen, for real though. But recently I have seen you doing full body stem cells on a few like noted people in our industry. So, and you did mention, so these are stem cells. These are not exosomes per se. Are these that person's stem cells, or is that okay? Yes.
Yes.
And
yes.
why would someone want it systemically and not locally? Is it only that we need more of them? Is that the price that's involved with it? Why do one and not the other?
So with the full body stem cell maker, we're actually doing a bunch of local injections, and we give some IV as well. But we're doing, my partner, Dr. Adelson, he injects all of the major joints in the body, all down the neck and the back, the shoulders, the hips, the knees, the wrists, like basically all the joints, with the patient's own stem cells and PRP. And then I will do facial injections, microneedling, scalp injections, and sexual injections with the stem cells. And then I'll use the exosomes topically in the areas, the face and the hair as well. So I will use exosomes as well, but it's primarily the patient's own stem cells that we're using in those procedures.
Understood. So it's not like you're getting them like NIV into the bloodstream and
well, we do an IV. We do an IV also, but that's not the main thing that we're doing. We're really putting them specifically in the places we want them to be. The IV, there's a lot of studies that show that IV stem cells, even just from the patient, may be helpful for helping with various diseases or longevity or things like that. We don't really know yet, and so we're not trying to, we're not saying that we're treating any specific diseases, but for longevity purposes, there is at least one study using stem cells that showed that there was some improvements in markers of aging and frailty and such. So I think that the jury's still out, but it's just your own cells. So worst case scenario, you just have your own cells put back in you again.
Mm-hmm. Sounds awesome. And that procedure is basically just like an overhaul. It's not that you're sacrificing like a localized response because you're doing it, overall the whole body. Is just like an approach to do everything at once, kind of.
Yeah, exactly. So a lot of people will have multiple things that hurt or they're connected. Like maybe they have neck pain, but that's also because they have problems in their lower back that they maybe don't know about. So it's kind of just a way to get in there and treat all the things all at once and try to promote healing all over. And,
understood something very interesting about the way that you provide results that I think is unique in medicine as a whole, is that you provide a service and then you're telling the person it's not like you're going to wake up tomorrow and the results are going to be there. That's like a process. You need to wait, and the results, you basically need to now have your body kind of respond and produce the result that you want. And I think that's interesting because I think maybe you can tell me more, but almost across the board in all the treatments that you do, which I think is amazing, and that's the way it should be. That is the case where even if it's like a laser peel, an injection, whatever that may be, the results come later on, right? So how do patients take it? Are they normally patient? Like, is it something, because, sometimes, for example, we have some, more affluent clients, they want everything immediately. So how do you balance these two things? How do you explain it? And also, I'm interested like in timelines, right? What are you looking at as far as timelines and results?
Yeah, I think your point is a good one. Like you have to explain to the patient ahead of time, here's what you should expect. And as long as you explain it ahead of time and you say, hey, you are not going to see much improvements or changes at all for the first 6 weeks. And maybe it's as long as 3 months, which is about what I tell people. So 6 weeks to 3 months is when you may or may not see improvements. And then you should start to see improvements in skin at about 2 or 3 months, in hair growth, maybe 3 or 4 months. So it takes a long time because you're asking your body to do something that takes time. Like you're asking your body to actually repair itself. We are all, we're all used to getting things quickly. And I get that. I'm also one who because I try so many different things on myself, I'm always like, well, like, I don't even know what's helping and not helping sometimes because I'm, doing so many things. And so I think that's a big problem. But if we're really trying to create change and not just sort of a quick fix, it does take time, whether that's with your skincare regimen or your lifestyle changes, or, even some of these procedures that I do.
Understood. And as far as so when I had stem cells, I've only had stem cells done once, and that was my own stem cells injected to my knee to try to avoid knee surgery. And it definitely helped recover from the knee surgery that I needed to do eventually. But yeah, I know. I mean, like when there's something mechanically wrong, I had just like a flap of meniscus just going back and forth there. Yeah. So there is a limit to what my body can do with a piece hanging out. But I felt a huge improvement in the way I recovered from surgery. So very happy I did it. But it was explained to me that because I was younger at the time, my stem cells I have a lot of them, and they're very effective. So when we grow, as time progresses, as a person grows older, are those stem cells that they have enough for them to get results from, or how do we improve those stem cells?
Yeah, I mean, yes, there is a point, and it's different for everyone, where your stem cells from your own body are not going to be as effective. We tend to see that it's, somewhere over 50 or so, 50 or even 60, because we're taking so many of them, like from the bone marrow, for instance. They don't have to be as effective as younger cells to still make a difference, but there is a point where they're not as effective. And so that's why, for a while there, we were using a lot of exosomes, because we would add the exosomes to the stem cells, and the stem cells essentially take in the exosomes. And at least what we think happens is that the proteins in the messenger RNA in the exosomes essentially get your stem cells to act like more youthful stem cells. So for a while, when we were allowed to, we were adding exosomes to the stem cells of the patient and then injecting that combination. And we thought that worked really great. Instead of that, now we're activating the PRP with a special laser to try to activate what are called the V cells, or the very small embryonic-like stem cells, which are very new, and we're still kind of experimenting with them. But there are some cells that are in your blood that are kind of sleepy or quiescent, and so there's some technology now that we can use potentially to activate those cells to make them more energetic and more awake. So we've been using some of that kind of stuff. But yeah, your stem cells do get a little bit tired as you get older, and lifestyle is a big part of that. What else are you doing? Are you exercising? Are you eating well? Or are you doing some supplements and things like that? But it happens to all of us, unfortunately.
Yeah, for sure. So is there anything that you are interested in you did mention a little bit, like B cells, things like that, but is there any technology that you're looking forward for the future? Like, how does the future look like as far as you're concerned, your practice is concerned? Like, what are you geeking about right now?
Oh my gosh, there's so many things. I mean, I would love to add more, complementary therapies. Our office is not really big enough to do it, but it'd be great to have like a hyperbaric oxygen chamber, because we know hyperbarics is so good for stem cells. I'd love to be able to do NAD infusions in the office, maybe before, after, and the days after, because that's great for stem cells as well. Anything that increases nitric oxide is going to help with stem cell activation and proliferation. So like red light therapy, for instance, or PEMF, or saunas, or things like that. So I would love to have, all the things in my office, but our office is pretty small. So instead, what I do is I just tell the patients that are coming in for these procedures, here are some other things that you can do at home. And a lot of my patients are sort of these biohacker types anyway, that often are coming from other places in the world, but a lot of them have some of these technologies already, or have access to them. And so they're pretty excited to put them to use again.
Awesome. That's interesting. So we've been a little bit obsessed recently, as far as a company like Young Goose, we've been obsessed with hyperbaric oxygen therapy, or HBOT, sometimes it's called. And that's an extremely interesting way to kind of also basically reawaken some repair processes in our body, right? And obviously we made a mask that initially we thought is going to be used only to improve the results within a hyperbaric chamber. Now we're discovering, and we're going to release a study soon showing that it mimics the effects of hyperbarics on the skin, even if you're not doing hyperbarics. So what is going on in hyperbarics? If you could elaborate a little bit, like why would it help you with your in-office procedures if someone did hyperbarics beforehand? Because basically hyperbarics is pressurizing a tank somewhere that the person's laying at and having them breathe pure oxygen. And that pressure basically overloads the blood with oxygen, oxygenates the tissue. And when the people come out of the hyperbaric chamber, there is kind of an opposite response where blood vessels kind of, supply less blood, less nutrients, and that pressure also increases the repair of the body. So first of all, you can add something if I've missed, but really, what are you looking for as far as helping you?
Well, the things for me, there's a big relationship between hyperbarics and stem cells, and the fact that hyperbaric oxygen seems to further activate stem cells to make them more active, to make them proliferate more, to make them send out more signals. So all of that is obviously very helpful. There's a lot of research in healing and how hyperbaric oxygen will help, promotes healing in different people. So certainly after procedures that we do, people are a little beat up. I mean, we're doing hundreds of injections, so it would be great to be able to put them in a chamber, really facilitate faster healing so they get up and at them, even faster. And then we know that hyperbaric will increase blood vessel formation and blood flow in a lot of areas. We've seen, like in erectile dysfunction, for instance, is where I've seen some of this. Is they did a study with men. They did it for some other reason. Like they weren't even looking at erectile function. They were doing it for other reasons. They did a series of these hyperbaric studies, and at the end of it, these guys were like, "Hey, whatever else is better, but also I'm having much better erections because that you're actually forming new blood vessels to carry all that new oxygen and everything." So I think that applies to skin as well, obviously for wound healing, for just general aging, trying to get better blood vessels and blood flow to the skin is going to be really helpful. So I haven't used it myself much, but I'm kind of following along peripherally by, Dr. Scott Scher, people like that who are amazing in the field, keep being like, "Dr. Amy, you got to get one of these." And I'm like, I know, I can't have all the toys though.
No pun intended. But okay, so actually talking about kind of segueing to your other form of expertise, which is, okay, now we have beautiful skin, we're impressive in our appearance, we probably will get more get courted more, or have a more
you're so prim and proper. I love it.
Excuse me?
You're very prim and proper. I love it. Getting courted.
I know,
more.
right? I mean, like now we can act on our new rejuvenated look, but we need to perform as we look as well, right? So first of all, I've seen, it wasn't that you were doing it, but I've seen someone inject stem cells into their penis, basically. Is that something that is now common? Is it something that now people are doing on a regular basis?
I wouldn't say it's common, but yeah, I've been injecting stem cells into penises and vaginas and clitorises for about 7 years now. And it's something that is definitely done. It's still considered to be experimental. There are studies that have been reported, and there's been some positive benefits for erectile dysfunction and for stress urinary incontinence, which is like when you pee a little bit when you jump, for women especially, and sensation and things like that. But it's still pretty new, and so I would say that it's definitely not a widespread thing, but it seems to offer some benefits for people using their own stem cells. And then I'm finishing a study right now where we used exosomes and injected exosomes into penises and guys who had erectile dysfunction, and to see if that was also beneficial. And I'm still waiting to gather the data from the other sites, but hopefully we'll have that published next year, if it came out positive. And so there's definitely some things we can do. PRP has been injected into those areas for a long time, and it seems to offer some benefits as well.
Okay, so where is there any difference between procedures, obviously, but what are the differences in approaches you have in that field for men and women? Because I assume there is many more differences in that than in skin health, right? What are like two different modalities that you would be approaching in men and women?
So for men, the injections are similar, like the injections with stem cells and PRP, that's similar for both. In men, we use a lot more of the low intensity shockwave therapy. So like Gainswave, which is a company in the US that's gotten known for that, but basically using high intensity pressure waves that's delivered through a handheld device, usually in the office. We'll do like a series of 6 sessions over the course of a few weeks. Is really great for reversing ED. And a lot of men are improving function, even if you don't have ED, by increasing blood flow and stem cell recruitment and nitric oxide release and all of that. So really big fan of the shockwave therapy or Gainswave. I'm a big fan of using penis pumps in guys who are not having like normal sort of morning erections. If you're not waking up with erections regularly, I think a penis pump is really helpful for the same kind of reasons, like getting blood flow, getting oxygen, keeping the cells in the penis healthy. I'm a big fan of nitric oxide boosters for both men and women, really keeping the nitric oxide levels up, which is going to deliver the blood flow to the pelvis, which is something that goes down as we get older. And then for women, I'm a fan of the injections. I do some of the vaginal lasers or radiofrequency devices, not as many of those as I used to. I'm really a big fan of pelvic floor health and kind of education for both sexes, and making sure that the pelvic muscles are either not too loose and weak or too tight and weak. And a lot of people don't know that there's a difference, and that the treatment's actually very different depending on what's going on. So that's something else I've become really interested in lately as well.
Understood. And kind of maybe going back to what we mentioned when we started, which was more basic ways to go about our health in general and sexual health. When someone comes to you with either performance issues for men or for women, it could be also the same, but just the experience, again, like looser, less performance, whatever that may be. What are some of the basic things? So you mentioned like exercise, you've mentioned nutrition. How do you evaluate that? Like, what are you trying to measure? Is it blood? Is it just their lifestyle according to what they're reporting? How do you approach assessing someone like that?
So I kind of have a 4-pronged approach to looking at that, to looking at sexual dysfunction, or looking at people who want to have better function. So I look at the mind. So I mind the mind. So that's stress, that's sleep, that's, what's happening on a daily basis. Because obviously your brain is your largest sex organ. That's where everything starts. That's where desire, arousal, orgasm, all that starts in your brain. And so that's all the neurohormones and neurochemicals that are in there. And so things like, how are you dealing with stress? How much are you sleeping? Is it good quality sleep? Like, social relationship, things like that will play into that piece of it. And then the next piece of it is the blood flow piece, which we kind of talked about. So making sure, you have nice, healthy blood vessels, and that's almost all lifestyle, limiting smoking, limiting alcohol, making sure you're eating a lot of healthy foods, exercise, and then boosting nitric oxide. That's all going to go to blood flow and trying to optimize that. And then the next piece of it is the hormones, and making sure that the hormones themselves are really dialed in. And that's something that that changes as we age, whether that's because we have pregnancies or breastfeeding or birth control pills or menopause, or for men, just andropause, losing testosterone as we get older. All these changes can affect sexual health. So looking at those. And then the fourth piece is the support the structures. And that's where we look at the pelvic floor health, the muscles, and then also the structures themselves. Is there any issue with the actual genitalia? And that's kind of the least likely area that the problem is. Like, it's usually somewhere else. It's not usually like in the actual genitalia, but we'll look at that as well if that's one of the potential problems.
Understood. And that would be that would actually also kind of apply to skin health, right? Because in the end of it, you're just making a healthier aside from the structural issue, but you're making a healthier, optimized human being.
Yeah. I mean, honestly, you could take that exact same approach and apply it to skin, which is what I think is so interesting that there's so much overlap between these two things, even though they seem very different. So there's a big mental component, a big stress component with skin. Obviously, if we're super stressed out, we'll see it on our skin, whether that's with, acne or with eczema or any other, types of rashes. We will see that. And so that 4-pronged approach absolutely applies to skin as well.
So, to maybe go to close it out with Amy and as an example. So what do you do? I mean, what are the homework you're giving yourself? Like if you were a patient, right? You're the closest to the plate, as we say. So what do you do in order to keep your health, your sexual health, your skin health? What approaches do you apply to yourself? We kind of said that you need to do HBOT at some point. Same goes here.
Yeah.
What do you do for yourself?
Well, currently I'm pretty good about sleeping well. So I get at least 7 or 8 hours of sleep a night, which I think is really important. And that has I'm pretty new to that in the last few years. I'm pretty good about exercising. I try to do strength training at least 3 or 4 days a week. And I do, when the weather's nice, I'll do hiking and get outside in nature, which is kind of my meditation, like walking out inside in nature. I have a sauna, and I've been doing a lot of sauna, which I love, for like my skin is like glowy afterwards. I just feel amazing. So that was really, really great. I have red light therapy as well, which I love also. And I don't do all of those things every day, but I try to fit them in. And then, I do my best with eating. I'm not honestly the healthiest eater all the time. I wish I was better. I need to do better. I need to eat more vegetables. Like I sometimes just kind of skip over those. So that's homework for me, is the diet piece of it. But, and I'm pretty good at stress management. I think that's something that is really important. And luckily I've been able to deal with the stress that I have pretty well with just through exercise and meditation and things like that.
Understood. Do you do any of the more new approaches? Have you done like stem cells on your own? Is it something that you're interested in kind of trying on yourself before you're trying on other people, or other people are the guinea pigs, and then when it works, do you do it on your own?
Honestly, almost everything that I've done on any patient, I've done on myself first. And I've injected myself with PRP, with exosomes, I had someone else inject me with stem cells. I haven't done that on myself, but almost all of the lasers and devices and everything that I've ever told patients to do, if I can do it on myself, I'll do it on myself first, or on my husband. He does not like it, but he's a guinea pig also a lot of times.
Great. Actually, I've never seen your husband. So does it work on him as well as it works on you?
He doesn't let me do as much on him, but I think that when I do it with it, he has good results.
That's awesome. So Amy, again, I believe your knowledge is endless. Like we can go into so many rabbit holes and just pick your brain, but I think it was a very good introduction to think what the future. You're kind of, again, as I said before, you are what would be common in every like street corner in 10, 20 years. You're doing it right now, safely exploring the most advanced technologies that we have to offer as far as beauty and sexual health. So as I again said before, all people need to do is really consume the information that you generously provide. Where would you think would be the best way to consume that information?
Well, as you mentioned before, I'm very active on Instagram. That's probably the best way to find me. It's Dr. Amy B. Killen is my business account on Instagram. I do a lot of videos, which are hit or miss, posts, other things, and we
love them.
It may just be you guys and me who are laughing at them sometimes, but that's fine. That's fine. I do have several different websites as well. DrAmyKillen.com is an easy way to find me. And then I have a couple of different clinic websites that I can refer you to also. But social media is the easiest thing. And then I can always send you over websites and things after that if you have questions.
And where are you located in the United States? Because I know a lot of people are flying to you and treating themselves to the treatment, that even if they don't live close to you. So where are you located in the United States?
I'm in Salt Lake City and Park City, Utah. Yeah. And I would say probably 85 to 90% of our patients come from out of state or out of the country at this point. So Utah is pretty easy to get to, Salt Lake City. And so people just fly in for a few days, and it's lovely here. So come see me.
Yeah, that is a young goose. We support this message. anyone who can definitely should come and see Amy. Amy, I want to thank you personally, also for the wonderful time that we have together, for the opportunity that you've given our products, and the way you support us is obviously something that we appreciate, and we hope that our products repay you in kind. And I wish us a wonderful, continuous relationship.
Yes, thank you. I will continue to use your products. They're lovely. Wonderful.
Yes, ma'am. All right. Thank you very much. And have a great rest of your day, everyone.
Thank you.